On November 15th, we reported that internal documents obtained by the Associated Press show that the World Health Organization has paid $250 each to at least 104 women in Congo who say they were sexually abused or exploited by Ebola outbreak responders. That amount is less than what some UN officials are given for a single day's expenses when working in Congo. That amount covers typical living expenses for less than 4 months in a country where the WHO notes many people survive on less than $2.15 a day. In interviews, recipients told the AP the money was hardly enough, but what they really wanted was justice. Joining us now is the journalist who broke that story, Maria Cheng from the Associated Press. Ms. Cheng, thank you very much for joining us on Forum Daily.
It's my pleasure. Thanks for having me.
So how did you first learn about this horrible story and what happened in Congo?
It's a story that the AP has been following for quite a while. It was actually another news organization which broke the original story, and that was in the fall of 2020 when they had a lot of anonymous accounts from women saying they'd been sexually abused or exploited by WHO and other responders during Ebola. So we started looking into this. WHO is an organization I've been reporting on for a long time. And the following year, we published an investigation showing that senior WHO management had been informed of the sexual abuse as it was occurring and did very little to stop it. And we had a colleague of mine in Congo went to some of these villages to track down the women that were sexually abused by WHO, including a woman who signed a contract that paid her off, essentially. And we published an investigation in 2021. And as the stories continued, we wanted to find out what has happened. And so talking to my sources within WHO and elsewhere, we received documentation of several trips that were made, including one in March when the head of WHO's new director of a Department for Preventing Sexual Abuse traveled to Congo and met with some of the victims. And more recently, we received documentation that, as you said earlier, more than 100 women have been given $250 in addition to some training as part of the package that WHO provided to these sexual abuse survivors.
And it may be a difficult question to answer because of the content of your answer, but what exactly happened to these women?
Well, there's a range of misconduct that they were subjected to, from women being pressured into having sex to obtain a job during Ebola, to being raped. There was an account of a 13-year-old who was picked up by a driver who said he worked for WHO, and she was taken to a hotel and raped. There are accounts of forced abortions, and around nearly 20 pregnancies that were a result of sexual abuse, as far as we know.
And just for clarification, these abusers were officially affiliated with the WHO and their Ebola response in Congo. Is that correct?
There was an independent commission that was appointed by WHO, and in their report, they found that there were something like 83 perpetrators, and of those perpetrators, 21 were WHO staffers. The others were working within the outbreak at some point, in some capacity, but we're not clear on their affiliation.
And you mentioned that there was a process for these women to be compensated. What was the process for these victims to be compensated for their trauma?
Well, there's been local programs set up in Congo in the epicenters where Ebola struck this, eastern part of Congo in 2018 to 2020, where they could sign up essentially for this package. The UN does not give out compensation, so they don't call it that, but they call it a victim survivor package. And it included this $250 payment. And alongside that, they were required to undergo some kind of training that would ideally help them generate future income.
But it was required that they would do that to have any form of compensation in terms of the criminal acts that had taken place.
The women that we spoke with said that as a condition of receiving that money, they were told they had to undertake this training. Yes.
Well, we will be returning with more on this very difficult subject with Maria Cheng. When we return from the commercial, we're going to look at an in-depth look at what that assistance fund from the WHO looks like. So stay with us. And we're back with Maria Cheng from the Associated Press. Maria, before the break, you had mentioned that there is a survivor assistance fund for victims of sexual misconduct. How much of that budget was spent compensating these victims?
Very good question. So, in the aftermath of the sexual abuse scandal, WHO set up a $2 million fund that's meant for survivors globally, but it's primarily been used for victims in Congo. We just did the math ourselves. $250
Mhm.
multiplied by the 104 women gives you $26,000. Um, so that amount is about 1% of that fund. We know there was other support provided. There was psychological counseling, and as I mentioned, this training that they were required to undertake. And WHO also mentioned that they provided some legal services for women who wanted to pursue a legal case. And there would be things like transportation and translation costs that the UN covered.
I mean, $250, you mentioned that there were several pregnancies and children born as a result of these assaults. What were the victims saying in terms of the ability to meet the needs of a child with only $250 being what they were compensated?
Yeah, my colleagues who spoke with the victims in Congo said that the women, by and large, were not satisfied with this. It's not a lot of money. It did not help them get established to a point where they would have the funds to pay for their children. And one of the women who met with the director of WHO's Prevention of Sexual Misconduct department told her that she had given birth to a child that had, quote, malformations that required medical treatment. And that resulted in additional costs for her. So WHO has said that they are also supporting a number of children with educational and nutritional grants. But the women we spoke to clearly were not satisfied, both with the monetary amount that they were given and in the fact that there's been very little justice for them in terms of having any perpetrators held accountable.
Well, yeah, and on that note, have there been any repercussions for the WHO staffers who committed these acts?
It's a very good question. WHO said that since 2021, 5 WHO staffers have been fired. Another 7 would have been fired if they were still with the agency. But the story we reported in 2021 showed very clearly that senior levels of WHO knew about this abuse, and no senior managers have been fired for their role in this response to this sexual abuse.
And when you reached out to the WHO, have they given any response or clarification on either that inaction or the what could certainly be the paltry amount that was given to the victims?
I mean, it's probably better for you to reach out to WHO to get their response, but I'll tell you what they told me, essentially. They said that the package was determined by local NGOs and other UN agencies working in the region. So this is what they determined was a fair amount for the women. And they also mentioned there was a concern not to give the women an amount that would stand out in the community and subject them to further harassment or harm. WHO also has said that it started a new department to prevent sexual misconduct, and they've spent something like $50 million on that and hired hundreds of staffers globally. But in terms of senior managers who are aware of this at the time, there's been very little action in terms of disciplining or any senior managers being fired over their role in this.
And I mean, what's the response been like for your colleagues who spoke to people on the ground in Congo? How how can they ever trust the WHO again?
Specifically to just that point, we did speak with some women who said if there is another outbreak and they see WHO responders coming in, they would be very wary of this. And they're still quite upset that they haven't been compensated both financially and in terms of seeing justice served. So
Well, Ms. Cheng, I very much appreciate you sitting down with us to discuss this horrible story. We will be certainly reaching out to the WHO for clarification, and we hope to have you back on to discuss how this develops.
thanks very much for your interest. I appreciate the time.